At this time, I have the pleasure of introducing Dr. Frazier Beatty. Dr. Beatty is the MPH Program Director and Assistant Professor at Regis College and has developed the largest public health group on LinkedIn with almost 140,000 members. Dr. Beatty has worked for state and federal government agencies, including the University of North Carolina at Chapel Hill and the U.S. Food and Drug Administration. At this time, I would like to turn the floor over to Dr. Beatty, who will present on the impact of healthcare disparities on the front line. Thank you.
Thank you, Dr. Kavanaugh. I am privileged to be on this stage with such a great host of panelists, Dr. Jocelyn Elders, who just spoke so eloquently, explained quite a few of the details and some of the things that I would also share in my presentation. Dr. Elders spoke about public health and the leaders communicating and getting the information out. Again, COVID devastated quite a few of us in public health, particularly healthcare workers, but minority healthcare workers suffered a great deal. They suffered mostly because of their status of being people of color. Before we get started, I want to go into some brief explanations. Dr. Elders so eloquently spoke about public health, how public health is the key. So I want to talk about the difference between public health and healthcare. Public health simply is prevention health, or the science or the art of preventing disease and prolonging life. Choosing a healthy lifestyle is public health. Planned efforts is public health. However, healthcare is the care that is provided by a trained medical or licensed professional, your doctor, your nurse, or your CNA, the person who comes to your home health aide. They're providing healthcare. But healthcare, the compound word, is the system or the business of taking care of people and putting people back to wellness. So for instance, public health will prevent you from getting sick, but when you do get sick, you go into the healthcare system or the system and you get the care to put you back or restore you back to wellness. So as we all know, most people infected with the virus will experience mild to moderate respiratory illness, and they will recover, not even requiring any special treatment. However, some people, minorities in particular, will require medical attention. And the reason why is because of underlying medical conditions like cardiovascular disease and diabetes, chronic respiratory disease, cancer. These are things that are likely to develop in serious illness. So minorities already face these disparities. So anyone can get sick or die at any age from COVID. We realize this. But the best way to prevent the slowdown in transmission is for everyone, just the same thing. Dr. Elders said it so eloquently. You have to be educated. Everybody needs to be informed. We have quite a few rural places in our country where people are not informed. The information is not getting out to them. And one, they believe in a lot of false information. Information is not being shared well. We didn't do a good job with the communication with this pandemic, and particularly because of the political climate. And we've heard people speak about that, and that's problematic globally. So, problem statement. Old school researcher and professor of public health. So it's really important for my students to understand why there's a problem. What's the problem statement? Why are we doing this in the first place? So underrepresented frontline healthcare workers face significant challenges when trying to provide care, especially during a global pandemic, because safety precautions, we've heard this already, PPE, personal protective equipment, and plan efforts to protect them are not implemented with health disparities, social determinants of health, and health equity in mind. You know, it's really important for us to understand where people come from, how they come to the table. And quite a few people come with lack of education, poor income, they don't have transportation, they're being discriminated against, you know, at work and all types of things. unsafe living environments. And these are the things that are impactful when it comes to healthcare workers. I wanted to bring your attention to this timeline, but before I go into the timeline, I wanted just to recap a little bit about N95s may be a better choice than the surgical mask. Now I go over to the VA for my care and they require you to wear the surgical mask as you enter the building. But is that enough? I'm not sure. COVID is still out there. Again, as Dr. Elders alluded to earlier about the percentages of populations and communities that are vaccinated in this country, we're behind some of the other places. And it started because of the communication efforts. It wasn't a coordinated effort. We were not collaborating across with different countries using best practice approach. And so we realized that we failed in a lot of regards, especially with the communication, but CDC was doing the best that they could in the political climate. Of course, you saw Dr. Fauci and Dr. Burke speaking on TV a lot of times, but it was just so much of a pressure politically. I'm not going to read verbatim these slides, but this is just a timeline of COVID at 6 million infections. We see this timeline, of course, in December 19, we heard about it. In January, it's the first death was reported. November, present day, they say it's over 150,000 deaths, but deaths in 13 countries doubled since July. And so we know that the rates are still going up. There's still infection. People are not wearing masks with fidelity. Health centers are letting down their guard and they're backing off of some of their COVID protocols. And so we have to do a better job. During the peak of the pandemic, and you also heard this with the Kaiser Health News report and the Guardian, early July, facilities were finding it difficult to contain the spread of the disease. The WHO, World Health Organization, estimates between 80,000 and 100,000 workers have died, and they came up with their summation between January 2020 and May 2021, about 115,000 deaths have occurred with healthcare workers. But it also reemphasizes the same thing that Dr. Elders was speaking about as it relates to different countries being ahead of us and how bad it looks. And again, so you hear some of the facts and some of the stuff that's being presented by the World Health Organization, very similar to what Dr. Elders was saying. I want to just give you some data and some facts on, they're saying the tragedy in all of this is that the US health system doesn't have a mechanism to track healthcare worker deaths. There's some estimates out there, and I'm going to share some of them with you. Like I said, in April 2021, the Lost on the Frontline report came out from the Guardian and Kaiser Health News, and they said nearly 600 and counting US workers have died of COVID. Of course, the title was published in June of 20, but the figure in April of 2021 was 3,607. And that's why the gentleman said 3,600 deaths, but it's much higher than that. It's much higher than that. And so we don't have a mechanism to track these deaths. The only mechanism, again, they discontinued in April of 21 was the Guardian, and they did a wonderful job. And once you get the slides, if you download the slides and you get the slides, you can go to this interactive link here where it goes and it shows all of the people who have died. You click on their pictures. I'll show you a picture of it. You click on their pictures and it gives a background of what they did. I mean, there were healthcare workers, lab techs, people who work in all aspects of the hospital support staff. 32% of the people who passed were nurses. From a global study that I found and researched, 20% were health support staff, 17% physicians. And when you break it down by race, 36% white, 26% Black or African-American, 21% Asian Pacific Islander, 15% Hispanic, and 2% Native American. And this is broken down by race. Also, just to put it in perspective, Tuesday, last week on the 6th, I went to the CDC's website. They're reporting that 964, it may be different now, But as of Tuesday, on the 6th, 964,627 cases among healthcare personnel. It's so off. And so they're not responsible for tracking, but the information is so skewed and so off. And they reported that it was 2,307 deaths. But I just wanted to bring your attention, there's no tracking system for the safety and the count of healthcare workers. And this is the picture of the website at The Guardian that I was telling you about. And you could click on the faces and the link, and it will give you their backstory and tell you some things about it. They memorialized every person of the 33,600 and put a different information about their background. It was really, really nice how they did it. What do we do about this? You know, that's the key, right? So COVID has certainly impacted healthcare workers globally, and it has really impacted minority healthcare workers globally, minority physicians, nurses, and other allied healthcare workers. It says 25%, it's about a third are at higher risk. And you see that from the NHS report, which is a website, nhsrho.org. And they do research. It's a global organization that does research on health equity. And they reported that 25% were at risk. They also reported that an estimated 30,000 healthcare workers have been infected with COVID in China. 22 have died, according to the report in March. And again, these numbers are skewed, but there are organizations globally that do research. The National Institute for Health Research in Leicester Biomedical Research Center in England, they have done research on the health disparities and how it has impacted minority health workers. We don't have a system in this country. So we see the improvements. We see the need for the improvements, and we see some things that we can improve on. I just wanted to offer some suggestions on how and what we can do as healthcare workers really to protect ourselves, particularly when health disparities and their underlying health conditions are in place. So for sure, leaders, again, we've talked about this over and over again, leaders should certainly be on the same page, and they should really take safety in consideration. Number one, we have to ensure that all of our healthcare workers have the proper PPE, make sure that there are COVID protocols in place. For example, hand washing, as we heard about the efficacy of hand washing, air filtration systems, as one of the presenters talked about, keeping the air clean, frequent testing. For instance, when the healthcare workers come into the facility, there should be frequent testing, but we got to make sure that we have the test. That was a problem early on in the pandemic. We had some tests and didn't have enough tests, and healthcare workers were going to work and working and serving, but not having the adequate testing supplies and PPE to be able to serve people that they serve. Limited contact, of course, we realize that social distancing is very important, and it's hard to do that as a healthcare worker. Telehealth, understanding how technology innovation have made a great impact on improving outcomes for delivering care, but utilizing telehealth, especially those people who are at higher risk, minorities, let them be the ones who are working with clients who are able to use telehealth. As we all also talked about, is getting the booster shot. The numbers are still low in the US. I mean, they're terribly low. As a public health professional, it's quite embarrassing. We don't have a communication strategy. We didn't utilize public health the way it should be utilized. We didn't go to the churches and elicit pastors to help people understand. We didn't go to veteran centers and ask the veterans. Here's part of the problem. We have people who are trying to educate people, but they're not from the place or the community that the people need to be educated. If it's a country boy, send a country boy down there to educate him. And so I know in rural Kentucky and rural South Carolina, where I live, people are not being vaccinated. And they're not being vaccinated because people are strangers coming trying to tell them to get vaccinated. That's just not how it works in public health. You got to bring somebody from the community to help them understand what the problem is. And when you don't, you alienate them and then they don't trust you. So public health is the key. Public health is important, but as we continue, we got to make sure we got ample water supply and sanitation stations where people can wash their hands. This is public health 101. We realize that disinfecting the place when someone new comes in as a new patient, adequate ventilation, as I've mentioned earlier, be sure to keep people away from risky activity. And those people who are high risk, give them the proper PPE that they need. If the N95 is the best practice mask to have, don't just give it to the surgeons, give it to the healthcare workers as well, the people who are working on the front line. Rest breaks. There's a whole nother level of overworking and stressing people out. Mental health has gone through the roof with COVID, particularly with healthcare workers. Now, I talked about the social determinants of health earlier, and I'm about to close. I talked about those things, but some people have to go to work. Some people they don't have the right transportation, they don't have the right income, and they have to go to work regardless of if they're infected or not. So I'm sure some healthcare workers went to work that were infected because their policies are not in place, and for social determinants of health have really impacted their lives. And so we got to give people breaks. Of course, we know all of this stuff. We just have to implement it. We know these things, high risk work areas, and treat people, especially those at high risk, better by minimizing the burdens that they face being healthcare workers. Again, mental health, the well-being, social support. There are so many service workers out there. Give them the social services and the mental health support services that they need. And also, lastly, pay equitable salaries to minority health workers. And thank you. I really appreciate, again, being on the panel, and I'll stop sharing my screen.
Well, thank you very much, Dr. Beatty. We do have one question. And the question states, Dr. Beatty, do you see a correlation between pharmacy deserts and low vaccinations and the lack of mask compliance among people of color in urban cities such as Detroit that is witnessing a recent uptick in COVID-19 infections?
Yes and yes. And I'll speak about the deserts. There's access or lack of access to quite a few pharmaceuticals, also access to just health centers in a lot of rural places throughout this country. We got to do a better job. And that's why it's important to utilize telehealth as a means to address some of those disparities in some of those rural places that don't have adequate health care. And please, Dr. Kavanaugh, could you repeat the last part of that question?
It said in lack of mask compliance among people of color in urban cities such as Detroit.
Yes, and that has to do with the fact that we're sending people into these communities to educate them who are not from the community. We have to utilize people of the community to be able to provide that education, to teach them and give them the proper information. I think that's part of what the problem is, helping to educate people.
Yes, I think this is one of the major problems that we're seeing here in our nation, because this pandemic has impacted frontline workers. Frontline workers are often minorities. And it's not just the workplace that is unsafe, but many have to use public transportation where masking is no longer enforced. It's a closed area and it's quite risky. And yes, they are getting infected. And unfortunately, the results that I'm seeing in the United States, well, are not as good in many other nations. We are having people that are getting infected 2 times. I know several that have been infected 3 times, and they're still getting very sick, and some of them are developing long COVID symptoms. So you can, for example, get infected, not have a quotation mark severe disease, but still be as sick as you've ever been at home, and then develop long COVID along with chronic disability. So this is really impacting frontline workers, and whether or not there's going to be an adequate or any real safety net is, I think, questionable, because we're not even counting the cases at this point, let alone having a good plan on how to take care of them. So I'm sorry about my little editorializing, but I think that this is a huge issue that the United States is going to have to deal with for many years to come.
You've done well. I'm looking forward to the remaining topics. And it looks like, I don't know if Dr. Elders was going to make a comment, but this is very important. And we really have to stay on top of it and try to figure out a way to address it.
Yeah, she's shaking her head in agreement. I think that's good.